So we're looking at walking and hip activation here. And so we have the 60% of stance phase, 40% of swing phase. And during the entire stance phase, our hip is basically extending. And so and you can see your gluteus maximus firing, and you would probably also see your hamstrings firing. So in the beginning of this movement, it would be isometric or eccentric, trying to control any sort of movement of the trunk segment or your head, neck, and trunk pitching forward at foot contact. And then towards the end, for toe off, you would be getting a concentric contraction to move your body forward at toe off. But again, not a huge amount of activation here, because moving forward at toe off during gait is primarily part of the work of your gastroc soleus around your ankle joint. But here we see then during swing, you are basically flexing, and you can see your iliopsoas or your hip flexors really firing. And that hip flexion also causes the momentum that causes knee flexion, which we talked about in the previous videos, and that would be a concentric contraction. And then when you're coming down to this little bit of extension, which is basically just trying to find the ground and the optimal position for your heel contact, it would be an eccentric contraction of your hip flexors.